128 channel hydrocell geodesic sensor net application. Informed consent. The hydrocell geodesic sensor net is a gentle yet sophisticated tool for recording dense array EEG. There is, however, always a minimal risk of skin irritation or skin damage with the hydrocell geodesic sensor net. It is important to practice informed consent with the patient during every net application. It can be reassuring to let patients know there may be some red marks left on the skin after application, but that these marks almost always disappear within a few minutes. Net application. Before application, soak the net in standard potassium chloride electrolyte for 3 to 5 minutes, being sure to submerge all sponges. Then remove the net from the bucket, shaking off the excess solution from the net. For the adult net, we do not recommend using a towel to pat the electrodes dry. Merely shake it briefly and then apply. The front of the net is identified by the face straps, including the chin strap and the ear straps. The back of the net is identified by the exit points of the wires. We recommend that you stand directly in front of the patient during application so that you can apply the net straight onto the patient's head. We ask the patient to close his or her eyes during the application and to dress the hair behind the ears. We also hand the connector to the patient. The next step involves proper positioning of the hands. To do so, identify the Nasian sensor, which is red. Count 2 sensors away from the Nasian sensor and hook the thumbs under the double lines of elastomer. Before applying the net, check that the chin strap is positioned over the wrists and that no beads or straps are tangled in the net. Position the little fingers in the bottom of the back row of the net. Using the thumbs and the little fingers to expand the perimeter, apply the net by gently pulling straight down onto the vertex, being watchful to keep sensors, straps, and fingers away from the patient's eyes. As the net is applied, it is very important to be aware of the position of the CZ and Nasian electrodes. CZ must sit over the vertex, and the Nasian electrode must be in line with the Nasian as the net is pulled over the subject's head. We then secure the chin strap. Do not leave the chin strap open because the net will come up and all the adjustments will move. 128 channel net adjustments. As soon as you have applied the net, tighten the chin strap. Do not leave the chin strap open or the net will come up and all adjustments will move. Be sure that there are no sensors covering the eyes. Make sure the ears are sitting correctly in the ear holes. Pull the net into position in large sections. Do not pull on individual sensors or the net will resist. Check that the reference sensor is correctly positioned on the vertex and that it is making firm contact with the scalp. Make sure that the net is positioned symmetrically on the head and that the midline of sensors is straight. Check the back of the net, making sure the sensors are perpendicular to the scalp and are not curled up. The mastoid electrodes need to be behind the ears. The facial electrodes should be placed underneath each eye, directly under the pupil. The Nasian electrode should sit on the Nasian. There are 3 different beads adjusting tension on the net. The blue bead adjusts the tension of the chin strap. The red bead adjusts the tension along the eyes. The white bead adjusts the tension below the ears and the back of the net. For the 128 channel net, make sure that you don't tighten the eye straps too much, as this can pull down on the Nasian electrode and make the net uncomfortable. Make sure that all the electrodes are seated below the hair. To do so, move the sensors side to side, perpendicular to the way the hair lies. This is done to part the hair and make sure that the sponge of each sensor is making good contact with the scalp. When seating the electrodes, firmly grasp the pedestal. Avoid grasping the wires or pinching them, as this can result in damage to the wires. 128 channel net removal. Before removing the net, we ask the patient to close his or her eyes and not open them until he or she is told to do so. We pinch the cord lock underneath the chin strap and slide it down the chin strap. Repeat with the eye and ear adjustments. Place the hands underneath the chin strap and lift the chin strap up and over the patient's face. Peel back the facial electrodes, being careful not to hit the patient in the face with the chin strap. Grab the two bands over the brow and lift the net slowly, peeling it away from the patient. It is important not to pull the net straight up because it will pull on the hair, which we've worked the electrodes through. Instead, peel the net back slowly, gradually working it out of the hair. The patient may need a towel to dry his or her hair.